Hi, I'm Nils Rosenbaum. I'm a psychiatrist. I work with the Albuquerque Police Department.
And I'm Matthew Tinney. I'm a detective with the Albuquerque Police Department. And I wanted to tell you guys about a case in which we wouldn't able to have successfully completed without the use of a psychiatrist. And this was a woman that came to our attention from multiple calls for service, for police calls for service or emergency calls for service. She made a lot of complaints that seemed to be about people breaking into her home, replacing furniture, stealing furniture or objects, or moving things around. And as law enforcement, we get lots of calls about break-ins, but this one was unique because she talked about things being replaced, or she started believing that there were shapeshifters or spirits that were able to go in and out of the walls. And we had attempted with field officers, so uniform patrol, to make contact to reduce these calls for service and get her help, but we just kept hitting the wall because we didn't have enough to take her into the hospital at these times, or anything with criminal justice that's not against the law to call for police. And one time she went to a substation, and luckily enough, we knew that Dr. Rosenbaum was available, and so we did an intervention there.
The detective and I, Matt Tinney, spent about 45 minutes interviewing her, and she clearly had some delusions about spirits coming through the walls. So we knew that she had psychotic symptoms, but we didn't know why, nor did we find any clear dangerousness until we really investigated. And it turned out that we asked her about safety and how she was going to keep herself safe from these spirits. And what did she say, Matt?
Well, at that point, she clearly demonstrated that she was going to keep herself safe by showing that she got a gun by doing this, and saying that anytime that she heard a spirit or what she believed to be a spirit coming through the house, that she would then proceed to just shoot her firearm in that direction, hoping to hit the spirit. And sure enough, we went out into the parking lot, and she had just purchased a firearm that day, sitting in her car.
So we took the gun, Matt took the gun into custody, and we got her to the hospital. She got admitted to a geriatric psychiatric ward, and she got much better. And it was a good communication between law enforcement and medical providers to make sure everything was evaluated properly and treated properly. So we were pleased with that outcome.
It was a nice way that hopefully we prevented a future tragedy with someone that had a firearm that really just needed medical intervention, but for law enforcement side, we just did not know how to get there, and so it was great having Doc available for that.
Hi, my name is Nils Rosenbaum. I'm a psychiatrist. I work with the Albuquerque Police Department.
And I'm Matthew Tinney. I'm a detective with the Albuquerque Police Department.
And Matt and I work together at the police department, and we try to help with cases of people who come in contact with police and try to keep them safe and get them into services. And there was one case where a patient's mom was calling the police constantly, worried about the safety of their son, and he was living in motels in bad neighborhoods. And Matt and I visited him frequently. I mean,
Yes.
we must have gone at least 15 times. Generally, he would slam the door in our face and yell an expletive. But eventually,
Show some hand gestures.
I wasn't going to do that. Eventually, he did talk to us, and I was able to talk to him about medicine. And he was somewhat receptive, but it took at least 4 or 5 more visits before he just one day invited us in, and we chatted with him for a long time. And we were, from that point on, we were able to get him into services on Medicaid.
Mm-hmm.
We on a subsequent visit, we coordinated with someone from Medicaid. We got him on medication. We found him an outside doctor, and within months, his apartment went from completely trash to clean. He shaved his beard. His mom was very pleased. It was a nice story, especially for someone in law enforcement, because
Right.
you don't often see the results of your hard work.
And he enrolled back in school. I think one of the unique things about it was frequent calls for service in law enforcement is typically handled in a criminal justice setting. So how do you get this person quit calling again, or get this person off the streets? And having Doc there to kind of guide our investigation in this, to say this looks like a serious mental illness, let's try rapport building, and we could effectively reduce the calls for service by engaging this person in services and get them into a long-time treatment. And for me, this was the first time I saw someone living with a severe mental illness. We always see the negative in law enforcement, but to see them in treatment and doing better.
Yeah,
And
it's nice.
he went from living on the streets to living in and out of hotels to going back to school. It was amazing.
Yeah, and he's doing well. So that was exactly what Matt was saying, a nice example of collaboration working out well for the community. Hi, my name is Nils Rosenbaum. I'm a psychiatrist. I work with the Albuquerque Police Department.
And I'm Matthew Tinney. I'm a detective with the Albuquerque Police Department.
We wanted to tell you quickly about a case that highlights the work that we do together. There was a man who was prone to psychosis, and at times he would get violent to the point that a SWAT team had to be called out to his house. And he was very strong and a large guy and kind of impervious to pain. They had to use a lot of tactics to get him out. He was slightly wounded. One of the officers were wounded, and he did get to the hospital. Subsequently, we, as a team with the detectives and I, were working more closely with him. So the idea would be to see him before he got very bad, or look for the first signs of his decompensation and intervene at that point. So we were working closely with the university, who is his outpatient provider, and with the field police. And together we met him and were able to get him into services earlier by establishing rapport while he was doing well.
This is a very different model than what's in traditional law enforcement. And with this particular gentleman, there have been actually multiple SWAT activations. And so this requires a SWAT team, a lot of heavy equipment, things like that. And he had a history of fighting with law enforcement. So he would get arrested a lot for felony charges and would injure a lot of law enforcement. So the typical model in law enforcement is we're very reactive. You wait until someone reaches that point of an extreme or a crisis, and it generates a call for service, and then you go out and handle it immediately. And so the approach of that Doc brought to it was, let's do a different approach. This might seem foreign, but let's intervene in the beginning. Let's, we have a history of this person going to continuously have these big calls for service and also fight. And ever since doing this earlier intervention, be it in the criminal justice system and jail itself or prior, we've actually been able to reduce. We haven't had another SWAT activation, and we have reduced any time that this gentleman has fought with law enforcement. In fact, the last time he had interaction with law enforcement was because he was actually helping someone out, get them to the hospital, which was nice. So he turned around and changed his civic duties.
Yeah, it's amazing. And it really is about making that human connection early and connecting them with the proper services at the proper time. So we were pleased. Thank you. Hi, I'm Nils Rosenbaum. I'm a psychiatrist. I work with the Albuquerque Police Department.
And I'm Matthew Tinney. I'm a detective with the Albuquerque Police Department. And I'm going to talk about the Crisis Intervention Team Model, also referred to as CIT. You can replicate this in any community, and here in Albuquerque, the model that we use starts off with collaboration. And so we include collaboration in all aspects of law enforcement when it comes to the response with behavioral health. So we'll use the local university, any advocacy groups, local providers, all together. This transitions to our training, which is a big part of this. Training isn't the whole program, but we do believe that we need to raise the expectations out of officers and those that we are hand-in-hand working with. And so this also goes to providers. We do training with providers, with medical students, with cadets in the law enforcement academy, and with senior officers, going over responses, didactics on mental health, and just decreasing the destigmatization of mental illness, and law enforcement and providers together as a big group together on this one. The other big aspect of it is a coordinated response. So we actually have full-time detectives that are pure responsible for responding to calls that are related to behavioral health and doing follow-up to build this rapport to better influence decisions that someone in crisis might be making. And a big aspect of that is very unique, is that we actually have a full-time psychiatrist. And so we're able to use him to help guide some of our decisions, which are outside of the traditional criminal justice mindset.
Matt, if you were in a smaller agency and they wanted to start a program, a CIT program, what would you suggest would be a good starting point?
I'd say the first thing is it's all collaboration. I think you should reach out to whatever you have in your local area. If you have a provider, reach out to your provider. If you have a local college or university, reach out to some of those professors or advocacy groups like the National Alliance on Mental Illness or any group that corresponds with someone living with a behavioral health condition.
I agree. I think collaboration is the most important aspect of the entire program, and it constantly renews the program, keeps it up to date, and makes it effective. Without collaboration, you really have people working in vacuums and nothing gets done properly. So I agree. What about having a coordinator?
I do think that it's very important to have a full-time person dedicated to this. That's where a lot of agencies have difficulty with manpower or given resources. But if you truly want to make effective change in your community, it's nice to have the police department or whatever law enforcement agencies in that area to dedicate that resource for that one person to be there and be that contact liaison for the officers that are encountering this, family members, providers, everything, to coordinate this collaboration because it's not easy and it takes time and it takes a lot of work.
I agree 100%. I think the main thing is that CIT is not just about training, although training is very important. Collaboration and then the actual responses are essential to have a program that functions properly. And I think it can be started in any agency, no matter the size, as long as you have one or two people who are interested in the program and willing to make phone calls to mental health providers or to police officers and start a collaboration.
Hi, I'm Mauricio Tohen. I'm chair of the Department of Psychiatry and Behavioral Sciences at the University of New Mexico.
I'm Matthew Tinney. I'm a detective with the Albuquerque Police Department.
I'm Nils Rosenbaum. I'm a psychiatrist. I work with the Albuquerque Police Department.
Today we want to talk about the importance of collaboration between departments of psychiatry, behavioral care providers, and law enforcement. And this is the approach that we've taken in Albuquerque. And it has to, well, first it's in terms of patient care. We very much see law enforcement as part of the treatment team. What do I mean by that? Well, many times individuals who develop mental illness or who already have a mental illness and have an episode, the first contact that they have is with law enforcement, is not with providers. Many patients don't come directly to the hospital. They just become ill while they're in the streets and they could get into trouble. They could be victimized. We very much believe in patient-centered care. That means that we go where the patients are. And certainly law enforcement is where patients are. So I want to share some of the experiences that we've had working together, including some of the challenges. I would say that a key thing is collaboration, not only in terms of patient care, I think also in terms of training and talking to each other. The more we know about each other's needs and challenges, the more we can work together because we have the same goal, which is to optimize the outcomes of patients with mental illness.
Absolutely.
Any experiences that you've had, folks?
Yeah, we have really done a lot more training recently and over the last few years. One of the things that sometimes is difficult for field officers is they'll take somebody to the hospital who says that may be suicidal or psychotic, and then they drop them off, and all they find out is that they were let out quickly or they don't know anything. And so obviously confidentiality is extremely important, but one of the ways to help officers feel like they're making a difference, which they are, is to train them. And to train, we have the director of the Psychiatric Emergency Services from UNM come teach, if you would like to talk about
That's right. I think one of the big misconceptions is in law enforcement, we assume everyone falls under the same guidelines as we do. So whatever law gives us the right as officers to take someone in for treatment against their will, we assume that that's the same law that gets them admitted. So we assume that everyone's getting admitted to the hospital. And sometimes it's the terminology that we use doesn't translate back and forth. And so there's just been this miscommunication historically between law enforcement and providers. And so now actually having providers there, we're humanizing it and making it so that the officers feel free to ask questions and we can translate back and forth the misunderstandings we both have, such as if someone's asking, why did you guys bring them to the hospital and not to jail? That's a big one we get when it's not against the law in this state to make threats against somebody. And so we can't just take people to jail because they're threatening people.
And you both make a very important point, which is the importance of talking to each other. Like the case you mentioned, that if officer brings a patient to the psychiatric emergency services and then the patient is discharged and the officer is not informed. And so Niels brought that to my attention. We talked among the faculty, and what's important is to make sure that the officers understand the issue of privacy, and that we just can't let law enforcement know once a patient is discharged because of confidentiality. And once faculty is aware of it and talk to officers, I think there's a much better understanding, and again, that leads to better outcomes.
Yeah, the outcomes are improved when the communication is better and there's less sort of lack of knowledge and sort of resentment. And once you realize and talk to them, and everybody is a person that you can ask questions and get good responses, it just makes things so much better, most importantly for the community and the patients.
Actually, the other thing is that when cadets start their training, one of the first things they do is they come to the psychiatric emergency services, they familiarize themselves with the staff, with the place, and I think that has led to great outcomes. I would say that our goal is the same, both for law enforcement and for behavioral care providers, which is to optimize the outcome of patients with mental illness. And the way to do it is to work together and to understand each other's challenges. I recommend this to any department of psychiatry who's looking after who is community oriented. I'm sure that APD, Albuquerque Police Department, would have the same recommendation.
Absolutely. It's been an incredible collaboration.